Hey everybody, it's Dr. Will Cole. We are live here in our Functional Medicine Health Center where we see patients around the world via our virtual functional medicine practice via webcam and locally in Pittsburgh, Pennsylvania. And today I have my friend Dr. Jolene Brighten here on our Facebook Live. How are you, Dr. Brighten?
I am fantastic. How about yourself?
I'm doing so good. So thankful. It's a busy day here seeing patients, but I wanted to take the time to talk to you. But before we get into all the cool health stuff we're going to be talking about, can you tell everybody what you do? I mean, you're doing amazing things in the world of wellness. Just kind of fill everybody in.
Yeah, so I have my own medical practice where I focus on women's health and specifically women's hormone issues, so endocrine issues like thyroid and adrenal. But my emphasis really is in the realm of the impacts of hormonal birth control and a condition known as post-birth control syndrome, which is the long-term side effects and consequences associated with hormonal birth control that don't just go away because you stop it. And so that's where a lot of my work has been in these last years. And I've been working on developing protocols. And as you know, I mean, people often forget as doctors, we're also scientists. So we've got to test everything out and refine these things. And so that's, a bit about how I work. I also work with women all over the world. I think we live in a really cool age where, you can work with people. Like we have clients in like South Africa and in the UK. And I'm like, this is just so awesome that like anywhere you are in the world, you can get connected to the expert who can help you.
Yeah, I love it. I know we live in a time where we're really getting people care where otherwise they wouldn't have care. They really have that support system, to that lifeline and help for people. It's really a cool place that we get to be at. The conversation that you have started of talking about birth control and educating women and men about birth control is you're the leading voice on this. So can you tell everybody how you see birth control affecting women's health?
Yeah. So the first thing I want to say is that we're not going to judge anyone if they feel like they need to do birth control to prevent a baby. So if you're using hormonal birth control because you can't get pregnant and that's the best option for you, then as a doctor, I want to make sure that I support you. But I think that, birth control has been part of the women's liberation movement. And in a lot of ways, I did the pill for 10 years. I'm a first generation college student and a doctor because I didn't get pregnant in my 20s. So it has been instrumental, but because of its role of really moving women forward in the workplace and giving them more autonomy and control of the reproductive system, we haven't had these conversations about what are the long-term impacts of hormonal birth control and how is it affecting our body? And so, some of the things that we see is, for instance, something as simple as nutrient depletion. So most doctors and women using hormonal birth control are not aware that it's depleting nutrients like crazy, disrupting your microbiome and contributing to leaky gut. That alone is going to trigger a chronic disease, given what your environment, your variables, and your genes are really, set up to do. But it's something where it's like, so if we take something like B12, hormonal birth control is disrupting B12. For everyone listening, B12 is super hard to absorb as it is. You have to have optimal hydrochloric acid, intrinsic factor, small intestine has to be on point. And if you don't have B12, it's going to cause your energy to tank. Your neurological system can suffer because it impacts the myelin sheath. So the way you actually have a thought is impacted. And so there's a lot of ways where, women go to their doctor, they get on hormonal birth control, they're expressing symptoms of depression, of anxiety, of gastrointestinal symptoms, inflammation, new onset autoimmunity. And doctors are like, yeah, but there's no study to support this. But when you get into the literature, and we need more research for sure, we're seeing that, for someone like you and I, who takes that functional approach, who is looking at the whole system, it makes sense how these side effects develop. If you're taking hormonal birth control, which we know is inherently inflammatory, causing a, low level insulin resistance, in a general human, if they have inflammation and insulin resistance, they're going to develop chronic disease and it's going to impact their life. So, that's just some of the few of the ways. I can spend hours on each one of those talking about how hormonal birth control impacts women. But, you know, my real movement in this conversation is that women deserve better than a Band-Aid solution to something that has a root cause. And when we don't question why a woman is having symptoms and we give her the birth control pill, patch, IUD, name it, for things that have a root cause, it's a great disservice. And this is when women end up in your practice or my practice, coming off of hormonal birth control, developing post-birth control syndrome, and realizing that all along they've had PCOS or they've had endometriosis or something else has been going on that's only been masked and covered up by hormonal birth control.
So true. This is powerful. And I agree with you. We need to echo and reiterate this so we're not shaming anybody or saying, you know, you're a bad person if you take birth control. But if you're going through health problems, you have to start taking inventory of the things in your life and are they serving you or sabotaging you? And I think that's what you're saying. And is there something better for the individual? So it's on a case-by-case basis for sure. So let's talk about birth control, if we could, and its impact on the microbiome. I loved that conversation. And in addition to that, how do you see birth control and its being a component to the perpetuation or the aggravation of different autoimmune issues? Because most of my patients are on this sort of autoimmune inflammation spectrum. Can you speak on that at all?
Yeah, so right there by you telling me that most of your patients are on the autoimmune spectrum, I know that you're mostly treating women, because who gets autoimmune disease but women? And so we're at a bigger risk. And what research is looking at is, you know, is it our hormones alone? And if we take that into account, that the ebbs and flow, you know, estrogen going up and down can impact and trigger an autoimmune disease, we can see that if you're taking a bolus of synthetic hormones, that could contribute. Now, what's really interesting is that, you know, there's a study that came out of Harvard showing that if women have the genes or the family history, so you don't have to get genetic testing, you could just ask your mom what's going on in your family. But if they have the genes for Crohn's disease and they're on hormonal birth control, they have 3 times the risk of developing Crohn's disease within a 5-year period. And I have seen this clinically where women come to me, they have new onset autoimmunity, they've gotten that diagnosis, we go through their timeline, and as it turns out, hormonal birth control was one component in that. It's not to say hormonal birth control is autoimmunity is complex. I mean, there's a lot more going on, but if it is disrupting your microbiome, so we know that good gut bugs can die off. Women have higher risk of yeast vaginitis, and that's generally because there's more yeast dysbiosis in their gut, so yeast overgrowth in their gut. But in addition to that, they have leaky gut. So now if you've got some bad gut bugs in there and your gut's leaking, these proteins get through. And how do we get autoimmune disease? Well, first you have to have the genes, although environmental toxins may be skipping that one for us. Leaky gut, and then the triggering event. And with the triggering event, that may be the initiation of hormonal birth control or the withdrawal from hormonal birth control. And so we're seeing studies that are pointing towards Crohn's disease and ulcerative colitis. We're seeing other studies that are questioning it for lupus, something that we know absolutely is linked to estrogen. And when we start looking at what is the number one autoimmune disease us ladies get, I'm one of them, Hashimoto's. This is something where I'm like, we need more research to understand now we know using hormonal birth control can be detrimental to thyroid health overall, but what is its impact in terms of, you know, triggering that autoimmune disease? So for instance, if you have leaky gut and you're binge eating gluten, that's something that absolutely you have the molecular mimicry. You could end up with thyroid disease. And was that gluten only? Was it hormonal birth control only? No, this is why medicine needed to change like yesterday. It's all of the things taking place in your life, which is why people need doctors like us to be like, let me break it down for you. What are your lifestyle factors that are contributing to this?
Really good. So, as far as if someone has taken birth control and they don't know what they should do, let's just say the woman is on birth control now and they see health problems in their life and maybe birth control is a component of this, what do they do? Do they should they obviously talk to their doctor, but do you recommend titrating off of it, going off of it cold turkey? What is your sort of approach there?
Yeah, so I talk a lot about this and this is what we do in my clinic and with my online program. So first things first, birth control is a medication. And although it gets passed out like candy in clinics, you do have to understand that it is a medication. And I think, it's downright dangerous for anyone to say, just stop hormonal birth control. Because one, if you cannot and do not want to get pregnant, you better have a backup method. And two is, if it is actually treating a condition, let's say they're using it for endometriosis, if you just stop, that might mean missing out on work for 2 weeks, being in excruciating pain. That can come with a detriment. And so generally what I advise is that, if you had any symptoms, that's why you start hormonal birth control, which by the way is almost 60% of women are on it for symptom control. If that's the case, you need to prep your body. So working with a naturopathic or functional medicine physician and getting that support so that you're replenishing your nutrients, you're taking care of your microbiome, but the liver is a huge component in all of this. And that's really something that gets missed by a lot of doctors, in the sense that when we're using hormonal birth control, it is the liver that has to take care of all that excess hormones. And if your nutrients are getting depleted and your liver can't detox as well, you're going to find yourself in big trouble when it comes to your hormones. So definitely there's the piece of the nutrients, get your gut right, make sure that you're loving up your liver like crazy, and then figuring out what your hormone imbalance is. Because as you come off of it, that's something that it becomes very apparent that, women are either, so often everybody's like, estrogen is the problem. And it's like, well, no, actually it's your adrenals. Like, we need to get your adrenals on point so you can ovulate again. And so figuring out that individualized approach of what your hormone imbalance is a crucial piece in making that transition successful. But if you're on hormonal birth control right now, two things: multivitamin or prenatal. You got to get on one of those, because you cannot out diet. Like, look, if you are eating the best diet possible, but your gut can't absorb everything, you're going to need that additional support. And then the other thing I recommend is that for as long as you're on hormonal birth control, in my clinic, we have women do a liver detox, like a 14-day liver detox about every 3 to 4 months. And that way we're replenishing. And these are, I use doctor grade supplements, which is replenishing the nutrients that are being depleted, and at the same time, loving your mitochondria and your liver like crazy. Because if you are on medication that's depleting your antioxidants, that's going to have a big impact on your mitochondria health, which are super dense within your ovaries. So if you want to preserve fertility, or, at least have a, easy, fun, loving, wonderful hormone life, you've got to be loving your mitochondria.
Mm-hmm. Very good. So let's say then the person goes off the birth control with their doctor. They've worked on that. Now they want to rebalance their hormones after they're off of the pill, or as many women find, their period's not coming back, and they just don't have a period for months and months and months after coming off of the pill. What are some ways, and I know there's a lot of nuance here and way bigger, everybody's different, but what are some bigger guns, so to speak, for women to bring into their life to start rebalancing their hormones?
Yeah, so post-pill amenorrhea, which is the absence of your period, that's been documented since the 70s. I mean, there's research studies going back into the 70s. The pill was introduced in the 60s that is showing that some women don't recover their period. Now, I have found clinically that it is possible, even if your doctor's like, you're never going to get your period back. I've had a lot of women who have been told they're infertile who do recover their period. And that comes down to, so there's all the foundational stuff that we've already talked about, but also understanding your adrenal, your thyroid, and your sex hormone health. Because the adrenal glands, I like to think of it as a pyramid, and the adrenal glands are the base of the pyramid. If they're not right, ain't nobody going to be right. And then there's your thyroid, and then your sex hormones as well. And so you have to look at all of that. Every one of those systems is impacted by hormonal birth control. So definitely diet and lifestyle goes a really long way. But we also need to start leveraging things like nutrients and herbs that we know can help restore the brain and ovaries talking again. So things like magnesium, we know help with the brain function and help the brain communicate to the ovaries. We know that, if you've got insulin dysregulation, blood sugar issues, that's going to impact your ovaries and your adrenal glands in a big way. And so you may need to leverage nutrients or go on a specialty kind of diet to really help support that. And then using herbs, things like Vitex or chase tree berry can be incredibly helpful. And in doing that, we've got to do it at the right time in the cycle. So if you're a woman who's lost your period altogether, you've got to do all of these things that we've talked about here. But you also have to recognize that it can take time to restore that. And it may take 3 to 6 months actively working on it. Some research shows it can take up to 2 years to get you ovulating again. But the reality is that the stuff that really helps is not sexy by any means. And it's not like, oh, earth shattering. Getting good sleep, moving your body, eating well, and doing it from the mindset that you want to communicate to your body that the environment is safe, plentiful with nutrients. And when you do that, that's when your body says, oh, let's make a baby. Now, whether or not you want to have a baby, like that won't force you to have a baby, but we all want to be ovulating. And Vitex is something that when used in the second half of the menstrual cycle, the luteal phase, or if you're not menstruating, going on a 28-day cycle and doing your days 15 through 28 can actually help with how the brain is communicating with the ovaries. And when you do ovulate, it can reinforce the corpus luteum in producing progesterone. And when we ovulate, what's left behind in the ovary is a structure called the corpus luteum. And that is why you want to ovulate, because that makes your progesterone, which makes you feel chilled out and calm and in love with your life. And if you're not feeling that way, don't start with hormonal birth control. Start with that root cause of why is that.
Love that. So and that's helpful, I think, for a lot of women that aren't having their period. Their cycle is kind of completely erratic. To just kind of stimulating the brain or communicating to the brain with something like Vitex, just 15 to 28 days to stimulate that normal function. I love that. So adaptogens, I love them. I'm a fan.
I'm obsessed, yes.
So how do you use them maybe in your own life, or what are some of your favorite adaptogens, maybe personally and clinically, that you like?
Well, I love rhodiola, and I love rhodiola because I'm a mom. And the research is like rhodiola never fails in the research, but it's an endurance herb for mental and physical endurance. And because I'm a mom, plus I run a practice and I do all of these things, I need that physical and mental endurance. So that's one reason why I love rhodiola. I also love licorice. Now, licorice is something that if you have high blood pressure, you've got to be cautious about using that and monitor it. But licorice works really well for women. It helps keep your cortisol around longer. It's a great, it has that anti-inflammatory component. But the other piece about licorice is that it will help with testosterone levels as well. And so in women with polycystic ovarian syndrome, or women whose adrenals are getting overstimulated, they're kicking out too much DHEA now, they're starting to get acne or hair loss, licorice can actually be tremendously beneficial for that. And then of course, mushrooms. I love mushrooms because you can cook with them. I'm a really big fan of for anything that you can start incorporating into your diet and have coming in that way. I think, that's a lot of how these things have been used, but that's another, I love mushrooms as well. And I know you have a great adaptogenic blend. I've yet to try that one. But I think adaptogens, they are so amazing and really overlooked a lot in women's medicine, because with adaptogens, they're going to help you regulate your cortisol levels. And if they can help regulate your cortisol levels, that's going to help your estrogen, your progesterone, and your testosterone function even better. Now, another one I really love is Gotu Kola. And Gotu Kola doesn't get a lot of play, but why I love Gotu Kola is because if you are pushing, stressed out all the time, you can get adrenal hypertrophy. So the adrenal glands start enlarging, they're trying to keep up. Gotu Kola actually helps modulate that so that your adrenal glands, the actual little structure, they're little almond shaped. They're tiny little things for people who are listening, why I'm talking about these little tiny glands, but it can actually help them so that they're not getting that overstimulation. So I love adaptogens. What are your favorite adaptogens?
I love holy basil. Holy basil is in actually my blend with Agent Natura Holy Youth. So I love that. And I love ashwagandha. I think ashwagandha is fantastic too. And I'm a big fan of the adaptogenic mushrooms as well. So chaga and lion's mane for this brain benefit. So I use those guys to varying degrees on a weekly basis too. And this one, Mucuna pruriens, from its L-DOPA benefits for dopamine production, from just a cognitive clarity during my day. I use that sometimes as well.
Yeah, I'm a big fan of lion's mane. I actually give it to my son as well. I want to see even more research on lion's mane, because it's, I am super fortunate that when I was studying herbal medicine in naturopathic medical school, Paul Stamets, who's like the godfather of mushrooms, like he's bringing so much mushroom information out, but he actually taught our mushroom courses. And I just learned so much about mushrooms. And I live in the Pacific Northwest. I'm blessed to live here because we actually go out and forage our own mushrooms. Like you could go out to the forest and they're just there growing for you. Ashwagandha, ladies, listen up. Ashwagandha, I think, is amazing for women's health because I'm like, it puts the hush on cortisol. It's like, yeah, we know cortisol. Shh, we're going to go to sleep now. But in addition to that, I have found great success with women whose breast milk supply starts to decline, that ashwagandha has been tremendously helpful with that. I think it's a great herb. Sometimes people are like, well, if you have a nightshade sensitivity, then you can't use ashwagandha. I don't know what you see clinically. I don't see that across the board. I have people who cannot eat peppers and can't eat tomatoes. They do just fine, if not awesome, with ashwagandha. So I think it's one of those things that's very individualized.
I agree. I think people with nightshade sensitivities, I've mentioned that before because it's worthwhile knowing it's in the nightshade family, but I don't think we normally don't see a problem with it. Even with people, again, with the peppers, tomatoes, eggplant problems, they're fine with ashwagandha.
Mm-hmm. And it's so great for the thyroid. I remember one of my herbal instructors, she would always say, if you've got a thyroid patient, like what's the answer? What's the herb you should be thinking about? Besides bladder rock and some of these other things, she's like, ashwagandha. It loves the thyroid so well.
Someone asked here, I know there's a lot of questions actually on here, so I won't get but someone, Fariha Ahmed, said, is ashwagandha good for lowering prolactin? I don't know if you have any information on that.
So Vitex is actually really good for lowering prolactin. In fact, there's been studies. So if you have a prolactinoma, which is a reason why women can lose their period, it's a benign brain tumor. So it's benign, but it can cause you to lose your eyes, your vision, not lose your eyes, but lose your vision. So just keep that in mind. But prolactinoma will cause excess secretion of prolactin, which is something that should only be high when you're lactating. And it's part of why we don't see our period come back. There was studies showing that, so bromocriptine is a drug that's usually used for that Vitex was as effective as bromocriptine in being able to bring down those prolactin levels. But the other thing to keep in mind is that the same mechanism that causes TSH to go up also causes prolactin to go up. So always a good idea to check your thyroid as well if you're starting to see elevations in prolactin. And the newer research and guidelines are actually saying that if you have one prolactin, you're not lactating, you have one prolactin lab test where it shows elevation, you should be considering getting brain imaging just to rule out that prolactinoma.
Great stuff. This is so good. So we talked about adaptogens, but what is one non-adaptogen supplement and food medicine that has changed your personal wellness game?
So my balance supplement, and I'm biased as my supplement, but but my balance supplement is actually a combination of Vitex, of black cohosh, of green tea, resveratrol. So all of those are going to help with balancing out estrogen, testosterone, and progesterone. And in addition to that, it has DIM and calcium D-glucarate, which helps with that healthy estrogen metabolism. And I'll tell you, I just figured this out. I took a trip to Austin a couple months ago, and people who follow me on social media know I'm very open about when I mess up and what that looks like. And I left my balance at home, and maybe TMI, but I had the worst breast tenderness, and my breasts were so swollen that I could barely wear my bra. And the reason for that is that I was traveling. When I traveled, I got constipated. Now estrogen reconjugated, it goes back into circulation. And then I probably had too much of the wrong estrogen metabolite. So it's not always just about estrogen, but it's about the estrogen metabolites. And so that was a big aha for me where I was like, okay, never leave home without this. Like, this has definitely been a game changer for you. And then when it comes to food, if you heard me on Balance Bites recently, my recent obsession is turmeric eggs. So I actually, I love, again, food is medicine. I will take turmeric and I just grate it straight into the pan because your microbiome loves this. Eat the whole food right into a pan with butter, and then I fry an egg in it. Oh my gosh, it's like the biggest treat. But turmeric is something, so I personally have autoimmune disease. If I get gluten, it feels like someone's putting crowbars into my joints and trying to pry them apart. And the biggest thing that I have found that like when that kind of flare happens is I can load up on turmeric. So, you know, whether I'm juicing it, cooking with it, and that has been a big game changer for me because you don't always know when you go out to eat. You're like, is this gluten-free? And you get told yes, and you just don't know sometimes.
Yeah, really good stuff. And we'll put in the comment section below, guys, the specific formula that we just were referencing as well. It's on your website, right?
Yeah, that would be awesome. Thanks.
Of course. All right, cool. So thank you so much, Dr. Brighten, for talking to me today. And like, there's so many truth. It's beyond bombs at this point. It's just like truth, nuclear power. So what is going on in your life? Like, what's the next fun things you have going on professionally, and how can people connect with you?
Yeah, so I am currently finishing up my book, which is coming out in early 2019. You know what that process is like. I keep joking that I'm going to write a book about writing a book because there's so much you don't know, but I'm super excited because I've documented all of my protocols around hormonal birth control, post-birth control syndrome, and I held nothing back. It is all in there and it is juicy. And I am super charged for that because this is going to take like women's medicine and put it directly into the patient's hands so that they can help change medicine and change their lives for the better. So if you're looking for a way to connect with me, definitely home base is drbrighten.com. That's drbrighten.com. There's tons of information and resources I share there. And then I spend a lot of time on Instagram, and you can find me at Dr. Jolene Brighten. And then of course I'm on Facebook as well, which we're sharing this over to my page as well, so that you and I will be linked.
Everyone will see us, and we'll put all of the links that we've talked about in the comment section below so everybody can check that out too. Thank you so much, my friend. I'm sure I'll see you soon somewhere.
Oh, definitely. And we're definitely really, my whole team and, you know, clinical team is amped up for your book to come out because it's the stuff I'm like, we're not going to have to tell everybody to eat their greens and do all of this. We're just going to say, here's your book.
Thank you so much. Yours will be coming in a few weeks. I appreciate you so much. Thank you for changing women's healthcare in a massive way. I'm really thankful to have you in my life.
Awesome. Well, I feel the same about you. Thank you so much for hosting me.
Awesome. Talk soon.
Bye.